I got a story I can tell to start off with.
No, your stories suck.
Okay.
Go ahead.
All right.
Pouty McPowderston.
So today we get a call.
This is an STD thing is today?
No, and it's actually not even STD related.
No, go ahead, Chris.
My stories are so good. So we get a call.
No.
Yeah. No, really. Yeah. For police. And this lady has been 86 from a store. They've kicked her out. And now she wants to go to an ambulance. Initially, she did not say why. However, upon our arrival, it was cleared up by the fire department. She now needed an ambulance because the police were shooting lasers at her.
I hate it when they do that.
Yeah, it happens. And so I'm on scene, and fire's giving me this, and they're doing their best to not laugh. Mm-hmm. And I'm looking at one of the police officers, and they're like, yeah, so she's really concerned that the police officers here have been shooting lasers at her. And I look over at the police officer, and I just give them this, what the hell, man, kind of look. Why are you shooting lasers? And he was a reserve officer, which God bless our reserve officers. America. And, but he didn't, on-scene humor wasn't something he's developed yet.
Right.
And he was very much like, well, we didn't tase her. And I'm like, no, I said, never mind. And so.
It's not funny if I have to explain it.
So the best part about this patient, though, was she very frequently tried to flip the script in the sense that we were the crazy ones.
Right.
And she had this all battened down. And the first evidence of this was the fire department was trying to get her comfortable, get her into the ambulance. And he goes, look, this is a laser-proof ambulance and has laser shielding and really trying. And she looks at me, she goes, that's not a thing. Don't tell me it's laser shield. And the thing is, she's right. She's right. It's not a thing. So we get her. So we get her in the back of the ambulance, and my partner goes, and she's like, "I got to take off my shoes. They've been shooting lasers."
For people out there, just so you know, patients taking off their shoes are generally a bad thing in the back of the ambulance.
I let it happen though because I was curious. Well, she was wearing a pair of Keds, which are really low riding things, and she had no socks on, and which is a worse scenario actually. But she's like, my feet have been getting lasered. They hurt every time I take a step. They're firing lasers at them, and she takes her shoes off, and she has like blisters because been walking around with no socks and in shoes. And she's like, see? And my partner says, no, man, that's from walking around with no socks. That's going to do that. And she looks at my partner like, no, that's not it.
Have you ever heard of Occam's razors, sir? Well, obviously, the lasers are the problem.
Well, yeah, the simplest thing. That's Occam's razor, right?
All things being equal, the simplest answer is generally the true one, yes.
Yeah. And so she says, the way she says it, she comes up, she's just like, it's obviously lasers.
Did she really say that?
Yeah. She goes,
that's
it's
awesome.
Obviously lasers.
And
she goes, I know you guys have been trained to lie, but it's obviously like, and she said it in a way as though like we were stupid.
Right.
Like,
or it's just common knowledge.
Who are you fooling here?
Right.
This is clearly laser blisters.
Okay. Everybody knows.
Yeah.
You've been trained to lie.
So anyway, not that that has anything to do with what we're about to talk about.
I had a lady one time who was being psychically raped by her neighbor 2 doors down.
She okay?
Yeah, she said her neighbor 2 doors down was psychically raping her.
No?
Through the walls.
Well, I mean, considering that like psychic, I mean, it could happen.
Lasers could be in her feet.
Yeah, that's true.
No, I like the fact that I like how she called the fire guy out in the
yeah. That's not a thing.
Come on, dude.
Yeah.
I'm not stupid. It's essentially what she's telling him.
Oh yeah. Yeah.
That's good. So anyway, welcome to Medical Stuff. My name is Mark. It burns when I pee Frankum. And this is Chris. Is this dripping normal? Fingston.
I was really curious what my nickname was going to be.
Now, is that better or worse than what you thought it might be?
Neutral. Because
Really?
you know what? I mean, at this point, Mark, there's a lot of options out there of what could happen. And so I learned to expect just about anything.
Yeah.
And nothing surprises me when it comes out of your mouth anymore. But yeah, we are talking about STDs.
Which, that's disappointing.
Yeah.
I just have to up my game, apparently.
Yeah, I'm actually a little more nervous about that. But yeah, we're talking about STDs, sexually transmitted diseases.
Also sexually transmitted diseases.
Well, I mean, it really depends on how good you are.
Exactly. How the night went.
Yeah, exactly. Also known as STIs, or sexually transmitted infections. This is a kind of a fun topic in the sense that I was really nervous as I was researching the topic that my wife was going to stumble upon my search history and have just a ton of questions. Yeah, I've noticed the last three searches were crabs, herpes. But yeah, we're going to touch on some of the more common ones and then some of the more uncommon but scary ones out there. Let's start with herpes.
Okay, herpes. There are actually a couple different types of herpes. There's genital herpes or genital warts.
Yeah.
And then there's also cold sores.
Yeah, and the big thing that we're going to be talking about mostly is herpes simplex. There's also other herpes like herpes zoster and herpes that are related to having shingles and those type of stuff. But when we're talking about sexually transmitted herpes, that is typically herpes simplex 1 and herpes simplex 2. First of all, though, herpes, by the way, is one of the most, and depending on which year you look at it, is the most common STI out there in the United States today with about 3 million cases per year.
Wow.
Yeah, that's a lot. So let's talk a little bit about the difference, kind of what you can expect to see when you contract herpes. And then we'll get into like simplex 1 and simplex 2 and the difference between the two of those. So signs and symptoms. So typically herpes simplex results in cold sores and blisters around the genitalia, rectum, and mouth. And it doesn't take a lot of creativity on how those can get from place to place in this instance.
Human centipede.
Oh, God. I've never seen that. But
So do you know where the idea for the story of that movie came from?
I have no idea, but I know what a human centipede is.
Right. So the idea came from the guy who wrote it and his buddy talking about a perfect punishment for pedophiles where they
really?
sew their lips to sweaty truckers' asses.
Oh, wow.
Yeah.
But what did the trucker ever do, though?
I think the truckers would volunteer to punish a pedophile.
Yeah, you think so?
Yeah.
Huh.
Anyway, 3 million people a year, huh?
Yeah, so 3 million people a year, and what you're going to start seeing is cold sores and blisters, genital, rectum, and mouth. And the first outbreak after infection is often the worst, and it may be accompanied by fevers and nausea. But however, severity as outbreaks reoccur will typically gradually reduce over time. However, it should be noted, herpes never goes away.
Well, it's a
on
virus.
its own. Yeah, it will stick around. And herpes is technically incurable. There are cases of herpes being eliminated,
Right.
but they're rare and really shouldn't be counted on.
The symptoms are cyclic. So you will feel better for a time, and then you can have a flare-up again. And from what I understand, a lot of times the flare-up will come when you're at a point of immunodepression for some reason, or you're under a lot of stress, which usually will depress your immune system.
Yeah, and that's one of the harder parts about herpes. And so you might have heard that, if you're not having an outbreak, you're not contagious. And generally speaking, the science behind it, that's true, because herpes is actually spread from blister or cold sore. That is where the virus resides. And it does actually spread outward from there. However, the problem with is because the cycles of outbreaks can be so variable based on things like stress. It's not as regular as say a menstrual cycle.
Right.
It's very difficult for someone to know exactly when they're having an outbreak and exactly when they're not, because an outbreak can be as minor as maybe a cold sore you don't see or you don't know that's there.
Right.
But you have it because of where these things can show up. I don't know about you, but daily viewings of my rectum is just not on my agenda. And so...
So your morning cleaning routine is incomplete, is what I'm hearing?
Viewing of my rectum. Viewing. I'm not using your bathroom anymore. So...
Well, the symptoms, the thing is to say that when you're not having a flare, it means you're not contagious. Technically, that's true.
It's just so hard to tell.
It's hard to tell when you're having a flare-up, especially as you get farther down the disease process, because your flare-ups can become reduced to the point where you don't really have the level of discomfort that you expect from the earlier outbreaks.
Yeah. And herpes, generally speaking, though, herpes... fairly mild symptoms. Mostly what most people with herpes are going to deal with are these cold sores that come and go. With treatment, and I'll kind of detail the treatment a little bit later, but with treatment, herpes can actually be fairly well suppressed and can really cause people not so much grief as time goes on. But herpes can become complicated and it can be serious. It's rare, but it does happen.
Well, if you get the open sores becoming infected.
That's one of the more common serious side effects.
And they can be life-threatening in rare cases where you just aren't treating it.
especially if you're not treating the infection. If you want to listen to our sepsis episode, we talk about how infections can turn deadly.
Right.
And an infection on your skin from a herpes sore has all the same potential as any other infection,
right,
to turn septic. Septic
into
being
the bloodstream and
yeah,
going to multiple organs
and causing organ failure.
Mm-hmm.
And that's certainly a possibility. Rarer things, I guess, that can happen.
In more rare cases,
is something called herpes simplex encephalopathy.
Chris, what is encephalopathy?
So encephalopathy literally means, so cepho means of the head. I believe it's Latin, of the head. And so pathy being disease. So encephalopathy is a word that literally means disease inside the head. And so herpes simplex encephalopathy is essentially when herpes spreads to your intracranial space inside your noggin there.
Right.
And actually can cause a swelling of the meninges, which the meninges are a lining, sort of like a saran wrap, if you will, around your brain. And they have various functions. But if they swell, this can cause pressure on the brain. It can cause the brain to atrophy, because what this pressure does is it actually squeezes blood away from brain cells, as well as cause physical damage to cause cells to break down.
Right.
And I think it's pretty obvious as to why that's bad for your brain.
So if you do get the encephalopathy from the herpes simplex, if you get early treatment, you have a 77% chance of surviving.
Mm-hmm.
But only 2.5% of the survivors will regain normal function.
Yeah.
So it's a very serious encephalopathy. I mean, not that there's like, oh yeah, it's a simple encephalopathy. You should be fine.
You're good.
But I mean, considering that even if you're in that 77%, only 2.5% of the people actually return to completely normal function. You're going to be a different person. Yeah.
And that is kind of one of the scarier sides of herpes that I don't think people are aware of.
Mm-hmm.
So about a third of the cases will actually result in death, even if it's treated in a timely manner.
Right.
And then 70% of patients who receive late or no treatment die.
Right.
So it's going to be pretty scary numbers there. So some long-term effects of herpes aside from the encephalopathy. So again, herpes cannot be cured, but a well-managed herpes can mean reduced and really mild outbreaks. In some cases,
like fights in the bar.
Go on.
Well, a well-managed bar will reduce fights and severity of them.
Yeah, but they're still going to happen from
occasionally.
Time to time.
You know,
I mean, you got alcohol,
people drinking.
You got idiots.
Yeah,
and quite frankly,
you're going to have fights, and somebody's getting herpes.
And, I had something I was going to say, but that's better. So let's just go with that. Oh God, where was I? Right. So there are some cases where people will stop having outbreaks altogether, and the herpes will be undetectable. In any case, though, someone infected with herpes should consider themselves contagious regardless of their outbreaks.
And I believe you may hear the term undetectable again later in this episode as we talk about HIV.
Yes, indeed. And syphilis. So symptoms of herpes can be treated. So yeah, we'll talk about the treatment here. So symptoms of herpes can be treated effectively with acetaminophen and topical lidocaine. Yeah. And
acetaminophen is a generic name for Tylenol.
Yeah. And lidocaine, that's a substance. I mean, there's a lot of uses for lidocaine out there, but in this particular instance, lidocaine is sort of a numbing agent. And so that can be used to get some relief from...
Well, it's in the same family as Novocaine.
The herp.
Yeah.
Yeah.
The herp.
The herp.
Is that what we're calling it now?
There are some antiviral medications that can be used to reduce the frequency and the duration of the herpes outbreak. The main one that you've probably heard about is going to be Valtrex, also known as valacyclovir. Valacyclovir itself needs to be converted in the liver before it's effective, and it's turned into acyclovir. And one of the things, though, one of the adverse effects of this is going to be you do have to get, I believe, it's liver enzyme levels tested every so often when you're taking Valtrex, because it does require an extra workload from the liver to metabolize its medication into the usable form.
And I mean, as a side note, your liver works very hard as Chris drinks a beer. Your liver works very hard to keep your body clean.
Yes.
So anything you can do to be kind to your liver is a good thing.
Well, I've heard it before where your liver starts dying the moment you're born.
Mm-hmm.
And it's just how fast are you going to let it die? So, which honestly, though, now that I think about it, you start dying the moment you're born.
Yeah, we're all heading that way.
Yeah, pretty much the clock starts ticking. So,
wow, this got dark really quick, man.
Yeah,
I gotta
boy,
tell
it
you.
did. Yes.
So I think we should take this opportunity, shall I say,
Yeah.
to mention proper sexual contact techniques.
Ooh.
No, not those kind.
Oh.
Keep it in your pants. So, this is not going to be a how-to audio podcast.
Well, I mean,
you know? What I'm talking about is that if you're with a partner that you are unfamiliar with, if you're with a partner who you may have, I mean, if you're in a long-term committed relationship, that's one thing.
Yeah.
Any other time, you should be using condoms.
And here's the other thing to consider too is that chances are, and this is not true for everyone, but chances are your partners had partners before you.
Right.
And one of the things you need to consider is that really, unless someone's been tested for STDs, and we're going to talk about some of these, there are a lot of STDs that can be symptom-free for a long, long time and that can be spread.
Yeah.
And that's something you need to consider. So really, aside from, abstinence until a single partner in a monogamous relationship, which really just, I don't know if that's a realistic expectation for most people nowadays. And even still, you don't really know that 100%. You just taking someone's word for it. Condoms really need to be used.
Right.
Yeah.
Well, I mean,
babies.
I mean, the old adages have been, you're not sleeping with this person, you're sleeping with this person that they've ever slept with.
Yeah. You're sleeping with their whole roster.
Right. So
that's very true.
if you're going to hump, cover your stump.
Oh, that's nice.
If you're not going to wrap it, take it home and whack it.
Wow. Where'd you learn these?
Years ago, there was a...
Is this what sex ed was like in the 50s?
No, I think this was beyond the 50s because back then they just didn't talk about it.
No, yeah.
No,
There
this
you go.
was actually in college. There was a National Condom Week top 10 list.
Oh, nice.
And that was a couple of them on there, yeah.
Nice.
Now, you can say, well, yeah, but I'm on the pill. Pill does not protect against sexually transmitted diseases.
No, that's a baby thing, dude.
It is a baby thing completely. So
Yeah.
you can, you won't get pregnant, maybe.
Mm-hmm.
And always remember that condoms, not 100%.
No, they're not.
The only 100% way to make sure you don't get a sexually transmitted disease, don't have sex.
Yeah. And don't share needles.
No, that's a good point.
Yeah.
Yeah, it's a really good point. So
Talk about chlamydia?
why not?
Yes. Yeah. There we go.
So it's pretty common, not as common necessarily as the herp, but about 200,000 cases per year for chlamydia.
Yeah. Chlamydia is disappointingly, I think it's actually gonorrhea is the clap. I don't think chlamydia is referred to as the clap.
Okay.
Which I think would be easier to remember. Like if I was going to name one of those the clap, I would pick chlamydia.
Why?
Because chlamydia and clap.
Okay.
Why
Yeah, I
should-
can see that.
Yeah. Why should either of them be named clap, really? I mean, it's like, round of applause, you got gonorrhea.
Yep, it's gonorrhea.
Yep, nailed
Gonorrhea
it.
is the clap.
I know my STDs.
And they know you.
No, that's not true. That's, back it up.
Jesse, that's
No.
not true, Jesse. It's a total bad joke by Frankham.
So with chlamydia, one of the things that actually lends to it being
Tested.
one of the things that actually lends to it being
Real quick. Okay, I do have to tell the audience.
Go for it.
Jesse feels pretty safe because Chris didn't have that kind of game.
Hey, come on. Come on.
Am I wrong?
Come on. I've got game. But one of the things that actually lends to, back to chlamydia, Mark. One of the things that actually lends to chlamydia being transmitted is that it actually, a lot of patients actually don't have any symptoms
Right.
of chlamydia. In fact, it's very common for people to be carrying chlamydia with no symptoms.
Right.
That's
But
how it gets spread. You don't know you have it.
the most common symptom, if you do have it, is painful urination.
And a lot of times, especially if people have frequent UTIs, that can easily be mistaken for something else that's not chlamydia.
Right. So, you can also have abdominal pain, pelvic pain, genital pain. And I believe chlamydia, yes, is also considered the pelvic inflammatory disease.
Yeah, if it gets, if left untreated, it can result in PID. It can also result, by the way, in pink eye. Just going to let everyone imagine how that gets there. And then, if infected fluids contact the eye, sometimes you can get a white, cloudy, or watery discharge. It can also occur in both men and women as well. And then it can also cause pain during intercourse.
Right.
But let's talk a little bit more about the PID.
So, PID shuffle. You ever heard of that?
Yes. Oh, yeah, absolutely. That was in paramedic school when we talked about PID.
Right. On scene of a call, 14-year-old female having severe abdominal pain. Family, they were going to take her to the hospital. She's collapsed.
Oh, boy.
They're very anxious. We get there. She's conscious.
That's
Vital signs are all good. Where you're like, oh, let's go to the ambulance. So she's walking out the ambulance, and I'm walking along with the firefighter. I'm like, oh, well, I know what the problem is anyway.
Oh,
He goes, what? So, look at her walk. This fire crew had never heard of the PID shuffle.
Really?
Yeah.
That was taught in class.
Oh, yeah.
That was, yeah.
So the PID shuffle is basically just that. It is because this has been untreated and it's causing just a severe amount of inflammation and pain, the patient will just shuffle along the otherwise healthy young person will shuffle because they don't want to take big steps because it hurts.
Yeah, because it moves their pelvis more.
Right.
And their pelvis don't feel good. So, yeah, so even though chlamydia is easily treated, when it hangs out untreated, you get PID, which is pelvic inflammatory disease. So, like Mark said, this is a condition that is caused when the body has an inflammatory response in the uterus, ovaries, and even the fallopian tubes as well. It's going to lead to severe pain and a fever, and can lead to infertility if unchecked.
Right.
So, also makes having an ectopic pregnancy far more likely as well too.
Well, that's because of the salpingitis. Salpingitis?
Salpingitis.
Okay.
Yeah, you said it right. You nailed it.
It's a severe swelling of the fallopian tubes that can prevent the egg from reaching the uterus. And if it gets bad enough, you're going to need surgery to correct this.
And for an ectopic pregnancy, you can also check out our OBGYN episode. I think I've got a good number of episode plugs in. So
yeah,
far.
that's really, you're above average.
Yeah, thank you. Yeah. I've heard of above average.
And if you want to hear about averages, go to our above average. No, I'm just kidding. Above average.
We talk statistics. Everyone's going to tune in for that.
Because you're so entertaining that we could play some statistics.
But yeah, so an ectopic pregnancy. So when you get pregnant, what happens is an egg pops out of the ovaries, travels down a fallopian tube, and then embeds in the uterus. If that egg doesn't make it all the way down to the uterus because there's a lot of swelling in the fallopian tubes due to PID,
right,
then it can implant in the fallopian tubes. If it then becomes fertilized and gets pregnant.
Question.
Answer.
If it's so swollen the egg can't get through, how does the sperm get to the egg?
Could be that the sperm is smaller than the egg.
No.
Okay. Well, then disregard everything I said. So then you can get the baby will start to develop in a space that's way too small for a baby.
That's really kind of sad that it's a fallopian ectopic pregnancy. Because I got to tell you, the sperm that fertilizes that egg, that's a fighter.
Yeah, that's true.
He put a lot of effort, or she put a lot of effort into getting to that egg.
Yeah.
Only to have a failed outcome.
Did you say he or she with sperm?
Yeah. No, I don't really. They're kind of gender neutral, so I didn't really know to go which way with that.
You know what? Fair enough, actually. I'm picking up what you're putting down.
Yeah. Because it's the sperm that determines the sex of the egg, right?
Yes.
Right.
It's true.
See, I know something.
Yeah. I'm patting his knee right now. So the other thing you can get is epididymitis. Slow down on that one. Epididymitis / orchitis, and that's inflammation of the epididymis. This is for men.
What does this have to do with whales?
Orchitis. Okay, got it.
Swollen whale syndrome.
So epididymitis. This is for anyone who has a testicles. So around the testicle, you have these kind of curly tubes. They kind of look, I guess, like really
curly tubes.
Yeah, they look like small ramen. I apologize to anyone eating ramen while listening to this,
or intending to eat ramen in the near future.
Yeah, well, you're probably not now. So
ramen sales have decreased after a podcast mentioned them. Anyway, moving on.
and basically, they're a pathway for sperm. But it can become infected, and it's right near the testicle. And then orchitis is the testicle itself becoming infected. So, and then that is
so no whales involved.
No, not even a little bit.
What about a male whale?
I mean, I guess you could have orchitis, epididymitis. I would like to see a male whale with chlamydia. Actually, I think that's a story in and of itself.
Seems kind of cruel to want to see that.
Okay, if I came out, so if you went to SeaWorld. And they're like, okay, guys, to your left is our killer whale, and to the right is a blue whale with chlamydia. Which aisle are you walking down?
But isn't the orca the killer whale?
Yes.
So the blue whale wouldn't get it because of orchitis.
But I think if you're an orca and you have orchitis, then you as a whale are infected entirely.
Right, but the blue whale wouldn't have the infection, the chlamydia, because It's orchitis, so it has to be the killer whale.
Not necessarily. I don't think that's right.
An
I don't think any of this
is
is right. I think this is so wrong.
I really think. Anyway, back to
back on
chlamydia.
track. So yeah, so epididymitis, orchitis, super painful inflammation in and around and of your testicles. And it can actually increase your risk of testicular torsion, which is where the testicle twist and then all the vasculature, the veins, while the arteries feeding it and the veins going away from it become obstructed, and you can actually lose a testicle that way. So we already talked about the treatment for chlamydia. We didn't really talk about it, though. We did say it's easy, and it is. It's a single large dose of azithromycin. It's just an antibiotic. It's very effective treatment. But important to note, patients can still be contagious up to about 7 days after they take it.
Right. Well, it always takes time for an antibiotic to take its course.
Yeah. So for Christ's sakes, keep it in your pants for one damn week.
Well, I think that people seem to think that antibiotics are like Tylenol.
Right.
You take it, and within a couple hours it works, and you're good.
Ding.
So some people seem to think that taking an antibiotic is like taking Tylenol. You take it once, and an hour later it's at full strength.
Yeah.
It takes time to get in your system. Basically, it's there to help your immune system. It doesn't take over. It doesn't really cure anything. It just kind of strafes out the part of it so your immune system can get it back, can get an infection back to the point where it can handle it itself.
And remember, it's got a long way to travel.
Yeah.
It's got to go all over your body to catch that infection.
Right.
So that's chlamydia. On to everyone's favorite now.
Mm-hmm.
Crabs.
Mm-hmm.
The crabs.
Not soft shell crabs.
No, not even hard shell crabs.
No, not crab cakes.
No, not. Ooh, that's a gross image. Because I like crab cakes and I like to eat them. I mean, not now, but I did.
So anyways, this is very common. Hey, we're back up to that 3 million infestations a year.
Yeah, no, crabs and herpes competing. Although I think herpes wins out, though, because crabs pretty easily curable.
Right.
Herpes, not so much.
Well, herpes is forever.
That's very true. Also known as the pubic louse, and the pubic louse or pubic lice, very, very, very similar to head lice.
Right.
Same lice are kind of useful. They don't lay as eggs as frequently as head lice do.
Right.
But they are very similar. So they are parasites. They're smaller than the head of a pin. They require another organism to live, which is why they're classified as a parasite. They feed off your blood.
If you're going to use that as a classification of a parasite, a baby's a parasite.
Yeah. No, trust me. That's actually what my wife used to call our child before she delivered.
Explains a lot, actually.
Sorry, sweetie.
But consider cutting that out.
Yeah.
They live by attaching to the pubic hairs of humans and feed on your blood.
Yeah.
Like the count. Okay, so females leave about 3 eggs a day attached to the hairs.
Yeah. And that's pretty much how they live. It's transmitted person to person by either direct contact, but
bumping uglies.
Yeah, bumping uglies.
Or just grinding uglies.
Yeah, it could be. Exactly. This is one of the things where, what do they call it? Like dry sex or dry hump.
Dry humping.
Yes, a dry hump could do this. But the thing about crabs, though, is they're an organism. You can also get them if they attach to like a towel.
Right.
They can get on that.
I've heard stories of people getting it by a public toilet.
Yeah, exactly. If they're an organism, they can fall off and they can hitch a ride somewhere else. So
the main symptoms are going to be itching that gets worse over time, probably some redness from scratching.
Crabs are visible to the naked eye.
Mm-hmm.
This actually is listed as a symptom because people oftentimes, it's very common. In fact, while I was researching this, I did listen to another doctor's take on it. He goes, yeah, I had a patient that came in. It's like, I got moles. I've got little moles. And, so you sit there.
So you got him an STD test and a psych eval all at the same time.
Well, I think this is probably just this guy's vocabulary. You also describe the patient in a few other ways.
Okay.
So, generally speaking, there's not a whole lot dangerous about crabs. However, if left untreated,
the danger comes from the spreading.
It comes from the spreading, and then it comes from the scratching as well. That's actually the primary complication. Isn't really much to do with the crabs themselves.
Right.
It's the scratching. Crabs can actually spread anywhere you have coarse hair, though.
Right.
So they don't have to stay just near
I would say, unrelated, I have psoriasis.
Yeah.
It is not that difficult to scratch yourself to the point you bleed and you break the skin. And so, especially if you have a sharp corner of your nail or something like that, you can make a nick on yourself and cause yourself to bleed just by scratching.
Yeah, I think scratching with sandpaper is also a poor choice.
Yeah.
So that's...
especially if it's on a sander.
Yeah. You should stop that, Mark.
Oh.
Yeah. But anyway, so yeah, if left untreated, it can spread anywhere there's coarse hair, though. Like you can get it, on your chest hair. Armpits is actually a really common secondary site for these as well.
Get it in your hair.
Yeah. So it doesn't go on to the hair on top of your head so much because that's typically not coarse enough.
Eyebrows?
Eyebrows and then facial hair, probably.
Yeah.
Yeah. I say anything that's more like pubic hair, where it's that kind of coarseness.
Dick face.
Yeah. I think you just want to call me dick face.
Like I need a reason to do that.
No, yeah, really.
So, but the good thing is, fairly easily treatable, just like head lice.
Yeah.
There are topical creams.
They actually do recommend some lice shampoos will kill both.
Oh, really?
Most of them nowadays. In fact, most of the treatments for lice are over the counter.
Okay.
The only time they really recommend seeing a doctor is when you have suspected infection, primarily from scratching. But nowadays, primarily.
Will shaving off the hair take care of the problem?
Actually, they do recommend reducing the hair in the area. That actually does help. So shaving the pubic area and shaving the pubic hair helps you spot, helps you monitor to see if you got everywhere. So what they recommend is you find there's shampoos and creams, mostly creams if you're going to be doing the pubic lice, and you apply the cream and you wait for a little bit because the eggs are harder to see and the eggs attach to the hairs. And so even if you apply the treatment that kills all the current live lice, most of the treatments won't kill the eggs right off the bat because the eggs are actually protected fairly well, just in the way that they're made. So if you kill the live lice and the eggs hatch, you're right back again.
Same thing with lice.
Yeah. And so what they often recommend is...
And I don't think you want to use a knit comb through your pubic hair.
It just seems like it'd be rough.
Well, it just seems like it would tug on hairs you don't want tugged on.
Yeah.
Yeah.
So you can do that, and then they usually recommend a retreatment later on to kill anything that you may have missed that may have hatched by.
Well, if you do dethatch the area that's the problem.
Yeah, that's true.
I mean, that would get rid of the majority of the eggs.
Right, because they're hanging on to those things.
Right.
But of course, if it's at the base of the hair and you don't quite get there.
Right.
So wax, I guess.
Right.
So yeah.
That would be crabs. Not the type that you get at the restaurant. Oh, well, no, okay. I can't say that 100%. Depends on what you're doing at the restaurant.
That's very true.
Yeah.
That's very true. Oh, gosh. How about syphilis?
How about syphilis?
So I found syphilis super interesting to research.
Mm-hmm.
Al Capone had syphilis.
They have a feeling that Jack the Ripper may have had syphilis.
Okay. Fair enough. Yeah. It's syphilis is actually, if untreated, super nasty.
Relatively low occurrence right now, though.
Yeah, I mean
88,042 cases in 2016.
Yeah, I mean we were talking chlamydia, which was 200,000,
right? And
that was considered common. I mean it's not herpes, which is 3 million, and this is 88,000 occurrences diagnosed in 2016.
But that's still quite a few.
Yeah. It definitely makes a list.
Mm-hmm.
It's an infection actually caused by a bacteria, and the bacteria is called. Oh God, help me out here.
Treponema pallidum.
Pallidum. Yeah. Treponema pallidum. Actually, that's not that hard.
Treponema pallidin, which is actually a character in D&D.
Actually, that was scarier than when you said it. It's actually not that scary anymore. It's not that big of a word. Anyway.
Chris is scared by letters.
Hey, no, I'm just scared by a lot of them. I can handle them in small groups when they gang up.
So signs and symptoms of syphilis.
So it really depends on which stage that you're in. So syphilis has 4 stages.
So like denial, acceptance,
exactly.
grief.
Which I think is absolutely like if all of a sudden like someone's like you have syphilis, I'd be like, okay, wait.
Well,
something's gone wrong in my relationship.
You're in denial, Chris.
Yeah, exactly. It can't be. It can't be.
Okay, fine. I've got syphilis. You've moved on to acceptance.
So there's primary, secondary, the latent phase, and then tertiary. So primary stage symptoms, typically you'll see about only 1 to 2 or 3 or so canker sores. The cankers are typically, but not always, these small, round, little firm areas, and they're typically completely painless, although not always. You're going to find these around the genitals, typically they're most common within the vagina and the rectum. They are far less common in males to actually have these cankers. So once again, you have a state where you have people who can have syphilis.
Is this the same thing as having a canker sore in your mouth?
It is. It's not the same thing as a canker sore in your mouth necessarily because those are kind of painful. Mm-hmm. But it is called a canker, so I suppose they're the same.
I'm assuming they come from different sources then.
Yeah. So you got those cankers that are there. The cankers will actually usually heal and then go away regardless of treatment.
You got them there cankers over there.
Really?
I ain't seen a batch of cankers like that in a long time. I gotta tell you.
That's the weirdest shit comes out of our mouths. So yeah, but if the syphilis goes untreated, it can progress to the secondary stage. So the cankers themselves really aren't that big of a concern. They'll go away on their own. They won't return in the secondary stage, and they're not a huge deal. But if you get to the secondary stage, this is actually where most people realize they have syphilis and where most treatment occurs. So in about 3 to 6 weeks, so this is a long game kind of disease. In about 3 to 6 weeks, the patient is actually going to experience a reddish brown rashes that form on the palms or the hands of I almost said the hands of their feet.
The forms on the palms of their hands or on the feet.
Yeah, that's
However, it's possible for the rash to show up almost anywhere on the body.
Yeah, it can happen. There's actually pictures out there of people with it all over their back, and it is kind of a muddy red brown. I've never seen it in person, but yeah, the pictures that are out there are kind of worth a look if you're not eating.
But the lesions will also appear in the mucous membranes, right? And they typically in the vagina or the anus.
Yep, and they can be very painful.
One more reason for you to be checking out your own beehole there, Chris, every day.
Oh God, there's like people that probably didn't want to know me this personally that are now listening. Like my mom, I think she listens.
Really, at this point, anybody's mom.
Well, no, my mom actually told my great aunt Priscilla that I have a podcast.
Great.
She's like 90 something. I love you, Aunt Priscilla.
Might want to.
Actually, I'm gonna put this out. My Aunt Priscilla is like in her 90s and still Facebooks.
Nice.
Yeah. She's probably like not in her 90s. I've just offended her, but that's there you go.
Yeah, but for you, there's your age, and then everybody above 50 is 90.
Pretty much. Yeah. I mean, you're well above 50, right?
You need to keep your chair away from me.
So that's when most of the treatment occurs because those are the most obvious signs. And again, it's also very easily treated. We'll talk about the treatment in a bit, but it can if those symptoms are ignored and it progresses.
The latent syphilis stage.
Yeah, and here's the thing: the rash will go away as well.
Mm-hmm. So you think everything's hunky dory?
Yeah, and the latent.
You are wrong.
Oh yeah. So when the secondary stage goes untreated, the symptoms will resolve without any extra treatment.
And Joy, you're still contagious.
Yeah. Although you're most contagious in the first and second stages, and in the latent stage, you're still contagious for about the first few months after the latent stage. You're still contagious, although eventually you no longer become contagious, but you will still get very sick.
Right. Well, this can last for years too.
Oh yeah, actually, the latent phase can last 10 to 30 years after the initial infection.
That's the tertiary stage.
No, the tertiary stage can occur 10 to 30 years after the initial infection. So that means the latent stage is going to last. So I have a question. Yeah.
Why is the tertiary stage the fourth stage?
You know what? I thought the same damn thing. Why couldn't they just
What is the definition of tertiary?
Yeah, third.
Third in order or on a level.
Fourthiary doesn't sound as good. I don't know.
Quatriary.
Quatriary.
Probably just doesn't flow well, so tertiary. Go for it.
Well, and latent's a good descriptor as well, because it really is latent. And so, so basically it's a symptom-free period where for a little bit you can spread it. You don't have anything. It also becomes progressively harder to treat as you get into the later stages.
Right.
So the latent phase can last years. And then tertiary syphilis. So this can occur 10 to 30 years after the initial infection. It's no longer the latent phase, and it can be lethal. Most people with no treatment will never develop tertiary symptoms and will just remain in the latent stage until they die of something else.
Being the fourth stage, technically, nobody gets tertiary symptoms.
Okay, Mark. The symptoms of tertiary syphilis can vary widely because it depends on where the infection manifests. So what ends up happening is the syphilis that's been latent for so long finally ends up residing in an organ system or in multiple organ systems. And the infection causes these organs to shut down. It's not good for them. And depending on what organs are shutting down can affect your symptoms. And so it can range from anything. So if you have kidney failure, your kidneys can start to fail. That can mean, because of syphilis, that can mean you now have trouble with urination, blood pressure. You're on dialysis. We actually we have a renal episode if you'd like to go listen to the renal episode as well. But in particular, and this is
Man,
actually...
You're selling it tonight.
I know, man. I'm on fire. We don't even have sponsors. I don't even think we need them at the rate I'm going.
The way this episode's going, we're not going to have any for a while.
Yeah. That's fair enough. But neurocephalus is one we are going to talk about as well, because neurocephalus is actually what Al Capone had. So he actually ended up with neurocephalus. So neurocephalus can result from tertiary syphilis, just like we talked about, but it can actually even occur during primary and secondary stages as well if you're just that unlucky. It can cause severe headache, difficulty coordinating muscle movements, paralysis, numbness. It can cause dementia, which is dementia is basically just confusion. Dementia is also caused by Alzheimer's. So if you're familiar with Alzheimer's, that's a kind of a good comparison there.
Well, Alzheimer's is a form of dementia.
Yes. And and Al Capone suffered from this. And of course, along with neurosyphilis, it can cause a degradation to the point of death.
Well, they feel that the reason that they believe that maybe Jack the Ripper had it was that dementia or the psychosis that goes along with this.
Right. And
also they believe that because of it causes erectile dysfunction if left untreated.
Ooh.
And that this could be something that motivates. Back in the days of Jack the Ripper, brothels were very common. And so you would go to brothel, not always the best standards. You get syphilis. They really don't know what it is. They aren't treating it properly. You get to the point where you can't get an erection. And then this could actually lead to an anger with women because they felt, because we always blame women.
Right.
You know, I mean.
Oh, and then go ahead and add, some dementia from the syphilis as well. And you got a recipe for disaster.
Right.
A recipe for a serial killer. Several songs in a movie. All right.
Millions of dollars made from other people.
Yeah, exactly. So, the HIV, AIDS, HIV, AIDS. So, HIV, I think, is one of the scarier ones. And it should be. You know, HIV does have a lot of potential to do a lot of damage and be lethal. And it's currently not curable. However, and we'll talk about this, we've come a long way. We've come a long way in the fight with HIV, AIDS. We don't have a cure, but we have people living full, healthy lives.
Let's broaden this out just a little bit. Do we have a cure for any virus?
Technically, no.
Right.
Virus just got to kind of run its course.
It's not like HIV is we don't have a cure for that. We haven't really figured out how to cure any virus. We've figured out how to minimize their interruption into your daily life.
And we figured out how to stop them from reproducing in your system, which is what we'll talk about with HIV and a little bit, kind of some of the things that we've done with it. But currently, so its prevalence, this is the rarest of the ones we're going to talk about today, but still noteworthy amount. There's about 38,000 cases, 38,500 cases were diagnosed in 2015. And that's actually good because it's down 8% from the preceding year. Globally, HIV has been on a slow but steady fall. And a lot of this has been helped with awareness campaigns started in the U.S. and the U.K. And also a big impact has been foreign aids to underserved countries. So HIV is human immunodeficiency virus. And that's different than AIDS. AIDS itself is not a virus. AIDS is a syndrome that results from HIV.
Well, it's it's acquired immunodeficiency syndrome.
Right. HIV is a disease itself. That's a sexually transmitted disease. And what it does is it attacks the patient's immune system. Specifically, HIV impacts T cells. Now, I'm not going to really break down T cells a whole lot. But T cells, they're called T cells because they're produced in the thymus, which is actually a gland that goes away.
Well, I believe in an upcoming episode, we're going to cover all of this.
Yeah, we're going to talk a lot about blood in general. And so stay tuned for that.
Right.
So, but T cells actually, they cover a range of functions. That's from helping other white blood cells, which white blood cells are a part of your immune system that flows through your bloodstream. They help other white blood cells by helping them to identify invaders, or by directly destroying the cells that are targeted as well. HIV binds these cells, multiplies within the cell, and then destroys that cell as it leaves to go find other T cells. So what this does is this basically takes your immune system out. HIV itself doesn't kill the patient.
No.
What we're going to talk about later is opportunistic infections. Without an immune system, without these T cells there to ward off infections and bacteria, whatever nasty stuff comes in. Anything can come in, and you just don't have any defense against it.
Well, when this first became prevalent, it was referred to in a lot of circles as a gay pneumonia.
Yeah.
Because this was rampant in the homosexual community. Because really, other than herpes up to this point, there was nothing you could catch that wasn't curable. And let's face it, herpes, even if you have herpes, the chance of that actually killing you is pretty slim.
Yeah.
So yeah,
if you want to know the chances of that killing, you can listen to this episode.
Yeah, exactly. Just rewind.
Yeah.
And go through that again, because apparently you weren't listening the first time.
Yeah.
So yeah, initially these people were dying from a rare form of pneumonia.
Right, and it was kind of baffling doctors.
It was, but that's why initially there was a misconception. This was although it is a contagious disease, people were confused about how you caught it because they thought it was a form of pneumonia. It was discovered in 1981 when patients were contracting a rare form of pneumonia that most people with a functioning immune system would not catch. Now, this is more common than people think. There are diseases like infections like MRSA.
Right.
Which
stands for?
Methicillin-resistant Staphylococcus aureus.
Obviously.
And this is an infection that you can get that if you have a depressed immune system will take hold in your body. If you're otherwise healthy human being, you'll carry it around for your entire life. You'll carry it around for your entire life and you'll never know.
Yeah, you'll be okay.
You'll be okay. In fact, as healthcare providers, they've done nasal swab tests. And if you've been in the healthcare industry for any significant period of time, you're probably carrying MRSA somewhere.
Why is everyone around me always sick?
Right.
So yeah, it takes time though from HIV to go to full-blown AIDS. And the time it's going to take varies wildly. In more substantial cases, I guess you could just say unlucky cases, it can take within 1 year. You can contract AIDS or you can contract HIV and then be in full-blown AIDS within a year. It can take up to 20 years, depending on the person.
Mm-hmm.
And the more and more patients, however, thanks to a lot of the advancements we have, we're going to talk about that later, but advancements in treatment, more and more patients are going their entire life without ever developing AIDS.
Right.
Once they've been diagnosed with HIV, the treatments have gotten very good.
Mm-hmm.
And they live, it's not just that they don't develop AIDS, live normal lives.
Right.
Yeah.
No, it's, and the thing is about it, it can happen as quickly as 1 year for you to get AIDS. But if you don't really have the signs and symptoms and it takes the 20 years, you're infectious that entire time.
Absolutely. I mean, in fact, as long as you have the HIV virus in you, you can spread it.
Right.
So,
but also HIV tests commonly, a lot of people don't know this, won't show new infections within the last 3 months.
And we are going to talk about exactly what that is. The most common test does not. In fact, the most common test actually just searches your body because your body will still develop antigens for HIV. They just won't work. And they can test for that. But perfect segue, actually. So there are...
I try.
Yeah. I mean, you're a professional at this point. So there are some... Now, we did mention earlier that what commonly kills people or what does kill people with HIV isn't the HIV. It's
the infection.
It's the infections that you get from that. But that's not to say that the HIV itself doesn't create symptoms. It does. So because of what it does, the signs and symptoms can vary, but there are some common initial symptoms that are due to the virus itself, and that involves body aches, fever, sore throat, and then swollen glands. Initially, the body can fight these symptoms back, so it's quite common for these initial symptoms to resolve after a little while. The other problem with it, though, is this just sounds like a day of catching the flu or being really sick.
And even with the herb, other than the rampant outbreak of the sores.
Yeah.
After that, you could just be feeling off a couple days. And you think, I just picked up a small bug, or maybe it's my allergies, or I'm just tired. I just haven't slept much lately.
Yeah. And so HIV can really mask itself as something completely benign. And also during this phase, as Mark mentioned, antibody-based detection of the disease can produce false negatives. Though there are tests that can specifically detect HIV itself, and that should still retain accuracy even during this phase, but that's not a common test. So most individuals will enter a period for many years with no symptoms after this.
Right.
Patients may then start to develop thrush, which is a fungal infection in the mouth or vagina. Thrush is kind of like sort of like a yellowy, almost kind of paste that you'll see.
And patients also may experience something called hairy leukoplakia.
Yeah, leukoplakia.
Leukoplakia.
Okay.
Tomato.
Potato.
Potato.
I knew you were a potato, man, you son of a bitch. But yeah, these are, and I would say, and these actually aren't that gross, but this is actually interesting to go look up pictures of. It's not that gross. You'll see some people, it's mostly on their tongues. But yeah, they're like these white little hairy brushes that form on the sides of people's tongues. However, leukoplakia itself is fairly common and not necessarily due to HIV, but hairy leukoplakia has only been seen in patients with HIV.
That's interesting.
So yeah, it's kind of a dead giveaway. So these symptoms. Oh,
go ahead. No.
And then these symptoms.
Go ahead.
You go.
No.
You go. No, you hang up. I'm sorry. The symptoms are also accompanied often by loose stools, fatigue, and weight loss.
Hey, so I do not have HIV.
And then, like we talked about, this can lead to opportunistic infections with no immune system in place that can then lead to death.
So, Chris.
What's that?
Treatment. As you said, it's come a long way. There used to be the point where if you had HIV, you were going to be dead probably within a couple of years.
Yeah, and I mean, AIDS was a death sentence.
You know, it was also initially, especially before they understood really what it was rampantly moving through different subsections of the population. Initially, it was through homosexual males.
Right, it was very common.
It also jumped into heterosexual couples or heterosexual population but through bisexual men. There was a lot of misinformation when it first came out. I remember people by droves keeping their children out of school because an HIV-infected baby or child would be in the school.
Oh, yeah.
You know, people were getting it through blood transfusions. All blood transfusions are now routinely screened for HIV because it was very common. Well, not very common, but it was a common way for people who were not.
It happened.
Right.
Yeah.
Drug using groups. I mean, you talked about people sharing needles.
Yep.
You know.
And so this is actually, and I guess we haven't really talked about the ways of transmission, but pretty much when it comes to HIV, it doesn't I mean, crabs and herpes can transmit just basically by contact.
Right.
HIV requires it lives in like vaginal fluids and vaginal secretions and semen, blood. And so if you're using a needle, that's pretty obvious for the blood transfer. And then obviously there's the sexual intercourse is going to.
But it doesn't live in like saliva.
No.
So although you can catch, now if you had oral sex with somebody and something happened and they caused them to bleed.
Yeah, or you have gingivitis.
Yeah.
And it's in their vaginal secretions.
Or semen.
Yep.
Then yes, you can transmit it that way. But kissing a person with AIDS, unless you just get really aggressive with that kiss.
So it's funny you mention that. So there is one, and given this is why you should listen to our medical myths episode part 1. There is one case, just plugging left and right.
Right.
There was like one case where they had gingivitis and they were actually transferred through a makeout session that way because basically both people had a bleed, had an open, and that's how it happened. It's one case out of 38,000 a year over history since 1981.
Right. And 38,000 is dramatically decreased.
Yeah, it's dramatically decreased. It was much more. And so that's just kind of one of those things where it's like, and then people freaked out because of that. And like, dude, that is one super rare instance.
Yeah. I mean, the thing is that, and I believe we talk about this in Medical Myths 1, there's always going to be outliers.
Oh, yeah. Extreme situations.
You know, there's always going to be that one. I mean, this is an imperfect world. I
would almost say that if that is truly considered catching AIDS by a kiss, then like don't drive your car.
Right.
Because
well, like I said, but back when this first really came to light, people were losing their shit over it. I mean, you find out a child who got HIV through a blood transfusion after a car accident is in the same school as your child. and hundreds of parents would be keeping their children home from school.
Oh, yeah.
You know, so, yeah. So, treatments.
We're back.
And antiviral therapies, antiretroviral, good Lord.
Antiretroviral.
There you go. Therapies.
Because HIV is a retrovirus.
Is the most common treatment available right now.
So yeah, there are three types of ART, if you will, or antiretrovirus therapies. So the first type is, they're nicknamed the nukes because they involve the nucleus of the T cells. And that's what we talked about earlier. HIV attacks the T cells. So what the HIV does is it attaches to the T cells, then it inserts its own DNA into the T cell, and then from there, it breaks out. So the nukes don't stop it from attaching to the T cell, but they prevent it from being able to put its DNA into the T cell for reproduction. So while the initial HIV virus will enter the bloodstream and attach to these T cells, it can't really go any farther from there. Next up, you have protease inhibitors. So this will allow the HIV to copy its DNA into the T cells, and will actually allow the T cells to then be destroyed and new HIV virus to spread, but it prevents the new HIV virus from maturing. So the initial HIV virus that gets in will be able to do its thing, but anything that's new from there won't be able to mature to the point that it can attach onto new cells. And then there's another one called entry inhibitors. So entry inhibitors, these block HIV from attaching to the T cell in the first place. So the T cell can still enter the body, the HIV can still enter the body, but it won't attach to a T cell at all. So doctors will usually prescribe antiretrovirus therapy from each of these classes, and they'll usually change it up. The reason they change it up, and there's actually a lot. So the reason we don't list them here is there's literally, I think there's like 20 different nukes, 10 protease inhibitors, and maybe like 5 entry inhibitors. And it's very common that for physicians to switch it up on which ones you're using. This prevents HIV mutations from effectively becoming immune to those treatments because the treatments don't stay the same long enough for enough of that mutation to occur. It should be noted, however, that none of these treatments, as Mark said, it's a virus, none of these treatments directly kill the HIV. Right. So even when on these therapies, the HIV can still be transmitted.
Well, there's a common phrase out there is that the person is undetectable because these treatments will get you down to the point where in an HIV test you become undetectable.
Yeah,
you're not cured.
You have stealth HIV.
You do. The chance of you infecting somebody is minimal, but it's there.
It is there.
And when if you're in a situation where a person is trying to convince you to have unprotected sex with them and they're undetectable, they may say undetectable is untransmittable. It's highly likely it's untransmittable. But what we're talking about here is contracting a virus that can very easily kill you. Mm-hmm. And you will have to be on medications for the rest of your life to make sure it doesn't.
Right. And then that is now a conversation that you get to have with all your future partners.
Right.
That is one of the fortunate things. Yes, we have, it's awesome that people are now living through this, but it still has an impact on your life.
Right.
HIV is always going to be a part of you.
Well, I'm sure these, I didn't actually look it up, but I'm sure these medications aren't cheap.
Oh, yeah. They've definitely been reduced in cost. But yeah, I didn't, I read something briefly about how they've been driving the cost down, which has been good. But yeah,
Well, and it's something you're going to be taking for the rest of your life.
Yeah, exactly.
And so, we still need to be careful. We still need to use condoms. We still need to, use safe sex practices.
Yeah. But some of the really good news on the HIV front, though, is, and I've been seeing this out there quite a bit in headlines, is PrEP. Mm-hmm. So there's now preventative things that people can do to prevent themselves from getting HIV in the first place. So aside from latex barriers, which we've talked about, abstinence, which we've talked about, people in high risk populations can take PrEP, which is pre-exposure prophylaxis. Truvada, that's the most common type of the PrEP medication. It can reduce the chances from receiving the virus from sexual contact by up to 90%. And it can reduce the chance of IV drug users getting HIV by up to 70%. Truvada essentially blocks HIV's ability to reproduce, much in the same way the nukes that we mentioned earlier do. And the pill is just taken daily.
So again, you still have to use safe sex practices, even when you're on PrEP. It doesn't give you a blank card, just go out and do whatever you want.
Yeah.
Yeah, do whatever you want whenever you want. You still have to be safe. You still need to use condoms. This decreases tremendously the chance of you catching HIV, but does not get rid of them.
Yeah. And I think one of the other things we have to keep in mind, too, is an important part is being forward about what you have.
Right.
I'll never understand. Not that I never understand, but, I'm never going to know what it's like to go through life with HIV. Well, I suppose I could, but chances are I won't. And there's things that I'm not going to be able to understand, but I sympathize with you. But at the same time...
Wait, we talked about this in a previous episode. You can empathize with them. You can't sympathize with them.
Ah, true. Which episode was that, Mark?
I don't remember.
Oh, nice plug. Nice plug. Glad I'm going to carry that one home for us.
It was actually on the transgender identity.
Yes, it was.
I know.
Yes, it was.
Who's a jackass now?
No. Wasn't it Psych?
No.
Are you saying no because you know, or no because you want to be right?
I want to be right. It was a previous episode. Moving on.
Anyway, yeah. So go listen to all of them.
Yes.
And then let us know.
Which
let
one
us
it
know
was.
in the comments. Yeah. So that's a conversation that does have to occur, and it's hard to tell people, especially people that you want to be with.
Hard to ask. I mean, if you're getting into a new relationship with somebody, it's hard to have it shouldn't be, but it could be very difficult to have that conversation with somebody before you start becoming sexually active with them.
Yeah.
So, sexually transmitted diseases.
Yep. That's
Should we stick a fork in this one?
Let's stick a fork in it.
So we are Medical Stuff. We're on Facebook, Instagram, and Twitter at Medical Stuff. I believe Instagram is Medical Stuff 52.
It is.
We are also on iTunes, Google Play, Stitcher. We're now on Spotify.
Yay!
And also Spreaker.
Yeah.
And we're waiting on iHeartRadio to get back to us on whether we're going to be accepted or not.
Is that Spreaker or Spreaker?
Well, yeah.
Because Spreaker is a person you and I both.
Tomato? Yeah, it was spelled differently.
Yeah, it's true.
It was so it's a different spelling.
It's true.
So we're on all of these places. Obviously, you found us if you're listening to this podcast. We love you for listening to our podcast. Tell your friends about us. Leave a good review. If you have any questions, comments, or concerns, please email us at medsidestuff@yahoo.com. That's medsidestuff@yahoo.com.
Well, you carried that whole outro by yourself.
So thank you for listening and have a good night. Toast.